Of course, we still continue to say it all the time. 2020 has looked quite different, especially with COVID and people focusing on their health more than ever. And of course, this is always in a special time of year and an important time of year when it comes to making sure your coverage is the one that you need. Let's go ahead, bring in national co-chair and the co-founder of America Covered, Joshua Peck. Joshua, how are you this morning?
I'm doing well. Thanks for having me.
I'm excited to chat with you, and especially with your title, of course, talking about Get America Covered. This has got to be your passion, then talking about how important this time of year is for the rest of the year to make sure people have the right coverage, right?
It really is. Open enrollment it's a special time. It's the one time where anyone between 18 and 65, who doesn't have coverage through an employer can go to healthcare.gov and get covered.
I don't know about you, Joshua, but I always like where you see where Florida, since we're talking from the state of Florida, where it kind of ranks in different topics. One topic, though, is healthcare. How does Florida rank among the other states? How expensive is it to have coverage versus other places in the country?
Yeah, Florida has more people enrolled in the healthcare exchange than any other state in the country. There are 1.9 million people enrolled. And part of the reason is because the availability of really affordable plans is incredible in Florida. This year, 4 out of 5 healthcare.gov customers in Florida can find a plan with a monthly premium of $10 or less. And last year, nearly 700,000 uninsured Florida residents, nearly 1 in 3, had a plan available to them with a $0 monthly premium.
Wow. Okay. So if you're just at $0, you threw out $10, people may be watching at home thinking, okay, how can I lower my costs to get numbers more like that?
So the 8 out of 10 healthcare.gov customers qualify for financial help, which makes their monthly premiums more affordable. A lot of people assume that help isn't for them, but it's actually designed to make coverage more affordable for working families. For example, a family of 4 with a household income as high as $100,000 a year is eligible for financial assistance.
Okay, so again, it seems like this time of year that deadline is more important than ever. Let's talk deadline. What do people need to know and where can they go for more information?
Tuesday, December 15th is the last chance to sign up for 2021 health coverage. If you miss the deadline, you'll need to wait almost a full year to enroll. So you should go to healthcare.gov today.
And before we let you go, I started this segment by talking about COVID. And of course, healthcare has been in the spotlight this entire year. Has COVID changed anything that you're seeing when it comes to medical coverage?
Yeah, every plan sold at healthcare.gov is required to offer coronavirus testing for free and the vaccine when it becomes available. We always say that people should get coverage because accidents happen and people get sick. This year, that's more true than ever.
I could not agree more. Again, it was really nice talking with you today. Thank you for all of the information. And of course, we've got that website on the bottom of our screen too, getamericacovered.org. Joshua, thanks for your time today and talking about this important information.
Thank you for having me.